Hi, I have Dr. Joseph Ranieri here with me, who's very experienced in this field of nutraceuticals, and we're going to discuss a few topics that are important in the program that we are teaching our patients, a VivaCorp program we call it, which is a six-prong attack on using nitric oxide mechanisms to make the blood vessels bigger and keep the blood pressure down and keep the arteries healthy. A mitochondrial, and we'll just explain what we mean by mitochondrial type product, where we keep antioxidants on board to help people along. A fish oil, omega-3 supplementation mechanism, which also includes natural fish products that you eat. Mediterranean diet we're going to talk about today, with olive oil being a major component, but there are many components of the Mediterranean diet that do not make any one crucial. They all work as a team in promoting wellness. Exercise program and how that does more than any pill or any supplement you could take in terms of what it does to the physiology of the body. And psychosocial stress reduction, which in some people is their only risk factor, and they think they're healthy, but if they have so much psychosocial stress, it can do havoc on your arteries and your nerves and cause damage slowly due to an oxidative process, which we'll talk about and explain what that is. So with that, I'll turn over to Dr. Ranieri and we can start a discussion about some of these topics.
What I like about this topic of discussion is I like to use analogies. So we know for the Roman Empire and the infrastructure, all roads led to Rome from the whole empire. With functional medicine, this is a form of functional medicine, all roads lead to the mitochondria as in a form of dysfunction. And Dr. Depace will explain in detail what that means. One analogy that I just spoke earlier about was, for an example, say neuropathy. I go to Dr. Depace about neuropathy. It's a symptom where I have pain in my nerves. It could come about from a back problem, a compressed nerve root. It could come about from if I was receiving chemotherapy. It could come about
Diabetes.
Diabetes, right? One of the most
common, yeah.
Exactly. As what we learned in medical school is our workup would be to do the history, the physical, do a series of blood tests, right?
That's correct.
Maybe proceed with an EMG, which will help determine if it's diabetic versus a problem in my back or some other. And then we may stop it there and then give me medications to relieve the symptom, but not medications to fix where the problem arises.
In other words, it's like a Band-Aid, sort of.
Correct me if I'm wrong.
That's correct.
Okay.
It's just ameliorating the problem,
So
but not getting at the root of it.
So we're in functional medicine. What we're going to talk about today, a functional medicine provider or physician would look at the amino acids, and if there's a deficiency in amino acids, that would ameliorate the symptoms and see if that would work in relieving the symptomatology.
And also antioxidants in that field, absolutely.
Right.
I agree, Joe. It goes much deeper than just relieving the symptoms.
So, Dr. Depace, my first question is, and I think it's good for our audience. What are the traditional and non-traditional risk factors for circulatory diseases that you recognize?
Yeah, circulatory diseases, and the reason they're important is because we need to get blood flow to the nerves that you were talking about, to the heart, the muscle, and if that circulation is impaired, that can accelerate neuropathies, can accelerate heart damage, tissue damage to other organs. So we need to keep the blood vessels open and the circulation working. And the risk factors that we know about are traditional ones that we get from epidemiological studies, like high blood pressure, cigarette smoking, diabetes, just getting older. Male sex is another one. And of course, high cholesterol. And sometimes we throw in low HDL cholesterol, which is the protective vacuum cleaner. Being obese, being sedentary, these are really traditional risk factors. Now, the non-traditional risk factors are things like psychosocial stress. Stresses on the body that we have to adapt to because they change our equilibrium, so to speak. And So there are non-traditional risk factors, and psychosocial stress happens to be one of them.
Are there any other risk factors that exist that we just don't recognize? Like, for an example, stress, genetic predisposition, environmental stress, anxiety, psychological.
And that's very true. So it's really called a non-traditional risk factor, the stress, the anxiety factors, and they're difficult to recognize because we don't know how to measure them. And the other thing is, you're right, the family history. Family history is actually a traditional risk factor, but a lot of times we don't take a good family history, or people just don't know about their genetics. And so we have to try to get it out of them if we can. And usually when you talk about family history, you're talking about people under the age of 60, 65, 60 getting heart disease. If they get heart disease at age 80, we don't really consider that a risk factor. We call that more of an aging degenerative type thing, and not a family history association.
So my next question is, and if you help explain this to us, what exactly is a mitochondria?
Okay. Well, now you're talking about risk factors we don't recognize. And risk factors we don't recognize, mitochondrial dysfunction is one of them. And that ties in with oxidative stress, where we get too much oxygen making free radicals. Another one we don't recognize is endothelial dysfunction, which is actually independent of all the risk factors we just talked about. Your endothelial dysfunction, if your endothelium's not working, it doesn't matter about your other risk factors. It's a potent contributor towards circulatory disease. And inflammation is a risk factor we just don't recognize often. Sometimes we say, I would measure the CRP. It's a little more than that. But getting back to the mitochondria is actually an organelle that's a little substance inside of every cell that use oxygen for the most part, except red blood cells. They're anaerobic. They don't use oxygen, and they don't have mitochondria. Mitochondria need to use oxygen. And each cell has about 100,000 mitochondria, and they're specialized for breaking oxygen down and making energy. We call that cellular respiration. And there's a structure of the mitochondria that I would like to go over and show a little diagram in, if I can. So as you can see in this diagram, which depicts the mitochondria, it has an outer membrane, fluid in between, and an inner membrane which invaginates, these orange folds going in. And these are where all the respiratory enzymes that are involved with oxidation are made or are stored. And in the middle is the matrix, and we'll talk about all the functions of the matrix. The DNA inside the mitochondria is its own DNA. It's different from the DNA inside the nucleus of a cell. The only problem is, even though mitochondria have their own DNA, which are autonomous, they, unlike nucleic acids in the nucleus, they can't repair themselves. That's why it is so susceptible to damage the mitochondria. That's why they get damaged so much. They can't repair the DNA that they have, their own intrinsic DNA. And that's why it is such a vulnerable or susceptible part of the cell to get damaged with free radicals and so forth. Now, in the matrix, the ATP is produced. ATP synthesis particles here. ATP is the energy that is produced in the body that makes us move, ambulate, do all kinds of activities. You need energy. It's ATP. That's where it's made. And that's why the mitochondria is called the factory or the powerhouse of the cell or the locomotive of the cell, because it makes all the energy molecules in its matrix, the ATP. Approximately 50 kilograms a day are made in healthy adults of ATP, enormous amount. And it's important for muscles to contract, cell division, all our fundamental activities. Now also in this matrix, this blue area here, we have what we call pyruvic oxidation, where amino acids are made, where iron particles are made, and sulfur are clustered together. Also in here is where the Krebs cycle occurs, which is where we synthesize some of the phospholipids for the cell membrane. And there's fatty acid oxidation also occurring, which synthesizes the fatty acids for the cell membranes. The Krebs cycle, which is over here, is a cycle which is important because what happens, it delivers substances like NADH and FADH, which can go into an electron transport chain, which, as you can see up here, the electron transport chain comes right off of the citric acid cycle, which is also the Krebs cycle, and produces water as oxygen comes in, because this is cellular respiration. Oxygen comes in, water comes out, and this electron transport chain produces enormous quantities of ATP in the mitochondria. So the matrix is very important for the fatty acids to be synthesized, which go into cell membranes, for the ATP, which comes through the Krebs cycle and the electron transport chain to form energy for the body. And also it is very important for the amino acid metabolism that occurs. Now, in mitochondrial diseases, which are defects in this respiratory chain up here, or in the citric acid cycle, or in here, when you get mitochondrial diseases and mitochondrial disorders, then we can see certain disease entities be facilitated to occur. And we'll be talking about a lot of these later on. So just remember, the mitochondria makes the energy of the cell. It's the powerhouse of the cell. The inner membrane has all of these enzymes that are important, and the matrix has the processes like the Krebs cycle or citric acid cycle and the electron transport chain occurring. And this is the power or factory of the body, but very susceptible to damage or disease because its DNA that it contains cannot repair itself, unlike DNA in the nucleus of the cell. It's great the mitochondria has its own DNA, it's autonomous, but it can't repair that DNA whenever it gets affected by something like a free radical. You smoke a cigarette, you get ionizing radiation, free radical gets formed and attacks the DNA in there, and they can't repair it, and so you can get mitochondrial dysfunction. And that's something that needs to be emphasized in human disease now. The primary source, interestingly, of reactive oxygen species, which are oxidation products which oxygen combines with, makes free radicals and cause damage to cells, occurs in the mitochondria. And so the mitochondria makes the most free radicals, and a lot of times it's called an electron leak. An example here, instead of going all the way out and making ATP and water from the oxygen coming in, we can get a leak 3% of the time, and some antioxidants get produced. And unless they are sequestered or taken care of, they can cause damage to the nucleus and proteins inside of the mitochondria. And this occurs about 3% of the time, whereas 97% of the time the mitochondria will make water after transferring electrons down this whole electron transport chain and giving us our energy. So when the mitochondrion gets injured, it releases calcium, and that could trigger death of cells, actually. That's how potent it is. So that's what the mitochondrion is in a nutshell, and the fact that it's susceptible to injury, it can't repair its own DNA, we have to protect it as much as possible.
So I find this very fascinating. Why I find it fascinating is the basis of our education in medical school. The first 2 years we learned about physiology and biochemistry, but thereafter we never applied its application to disease states until now under functional medicine. Didn't realize the importance of biochemistry up until now. Now you talked about how free radicals are damaged, the intrinsic mechanism, its inability of inherent repair. What antioxidants help repair it?
Okay, well now we got to go into a lecture actually on what is oxidative stress, what are free radicals, what are antioxidants, and what is the hypothesis of oxidation. The hypothesis of atherosclerosis, we call it oxidative modification. So what are free radicals? Well, free radicals are chemicals which sequester radicals. Antioxidants are chemicals which sequester free radicals, which are bad chemicals. And let's go into the basics. Aerobic organisms use oxygen. And when they take in oxygen, the mitochondrion takes a lot of oxygen, as you see, and makes water and ATP. The oxygen is there. It's contained in reactive species. Oxygen can have an extra electron free floating in its outer shell. We call that superoxide. Or it can form hydrogen peroxide, which can give rise to free radicals, or it can go to water, which is a good route for it to go. Or it can form hydroxy radicals, or singlet oxygen. These are all what we call free radicals. They're very reactive species when oxygen becomes unstable and combines with something and has, for example, an extra electron in its outer orbit. It needs another one to keep it company. We also have nitrates that become sort of free radicals. Nitric oxide is a free radical, for example. It should go to nitric oxide to make the smooth muscle contract, but sometimes nitric oxide combines with oxygen and gives us perinitrate, which is a radical that can cause damage. So it can be good, it can be bad, nitric oxide, depending on the environment it's in. If you have a lot of antioxidants, it's good. It's going to go and contract your smooth muscle, and rather relax the smooth muscle, and make for vasodilatation, a larger artery. So oxidative stress is not good. It's a matter of oxygen causing abnormalities as it combines with other substances, or it becomes free with an electron in the outer shell, and it can damage tissues like DNA, protein, the nucleus, and so forth. And that basically is oxidative stress. And reactive oxygen species and free radicals are the things that can cause problems. Now, one of the big problems we worry about is perioxidation from these free radicals, where these free radicals from oxygen or free radicals from nitrogen can attack the lipid particles and oxidize them. And then they go into the macrophages, which is your gobbling organisms in the cell, which gobble up debris. They gobble this oxidized lipid up, this oxidized LDL cholesterol, and cause the foam cell, which is the start of atherosclerosis. So the process of oxidation, oxidative stress, and making these free radicals and oxygen species, and some of these nitrogen oxygenated species, can cause damage to cholesterol molecules, which we need to go into membranes, but they damage them, and then they begin gobbled up by macrophages and cause what we call a foam cell, and these foam cells go into the artery and eventually form atherosclerosis, which is the beginning stages of this here. Now, what is an antioxidant? Well, an antioxidant is a substance that can prevent, reduce, or repair these reactive oxygen species induced damage from these oxygen-created species or molecules. So antioxidants are good, and we call it the antioxidant buffer. You want your body full of antioxidants, which is a defense mechanism. It's a buffer. Because remember, I told you the mitochondria over here produce a lot of free radicals, and they don't have DNA that can repair itself. Once free radicals form this mitochondria and you don't have enough antioxidants around to sequester them and gobble them up, you're going to damage that DNA, which can't get repaired. You get mitochondrial dysfunction, which promotes a lot of disease entities, we believe. And we'll talk about some of these things like chronic fatigue is an example of a mitochondrial disorder, and we'll talk about a lot more of these things and go through a whole list of them. And so this is very important to sort of cut it off at the pass. Now, also you should know that vitamin E, vitamin C are great antioxidants. They're vitamins. Our body don't make them, so we have to take them. Other antioxidants are alpha-lipoic acid, which our body makes. Coenzyme Q10 our body makes. Folic acid our body makes. A lot of fruits and vegetables have tons of antioxidants we take in. So we can get a lot of antioxidants in the body. We just have to make sure we do keep them in the body because they can remove or repair damaged reactive oxygen species and free radicals, and therefore don't damage all these nucleic acids and lipids and proteins, especially in the mitochondria. Now, I hope that answered your question to some degree. Now, oxidative stress was defined or developed in 1985 by Dr. Helmut Sees, and it really is when you overwhelm the capacity of antioxidants to sequester these free radicals. So oxidative stress is when you have a seesaw. You have free radicals here, and you have antioxidants here. When the antioxidants are too low and the free radicals are up, then you have what we call oxidative stress, and damage to cells occur, and that's what we want to avoid. We want to avoid this from happening. And this is what causes cells to age, senescence, abnormal proliferation. It causes inflammation, tumor genesis, and so forth. So overt oxidative stress actually causes cell death. We have to avoid it, and one way to try to combat it is to build your antioxidant defenses, which we call the buffer mechanism against oxidative stress. Does that sort of make sense?
It does make
And it's
sense.
down to the, like
Yeah.
you said, the biochemistry level.
What I find amazing is that this approach, functional medicine, complements traditional medicine approaches. Your traditional medicine approaches, you don't discount. You don't discount the fact that patients need anti-lipid therapy, that they need antihypertensives. But you go beyond that with this complementary approach down to the cellular level using supplements, nutraceuticals, vitamins.
That's exactly right. And what we have to realize is that statins, cholesterol medicines, have antioxidant activity.
Exactly.
A lot of these medications, some of the blood pressure medicines, angiotensin converting enzymes like Vasotec and Alloprol, lisinopril, there are some antioxidant mechanisms involved there. So even the pharmaceutical things that are not vitamins or are not natural substances in our body have or fruits or vegetables, these have some antioxidant activity in it. And the thing I was going to say is about oxidation is bad. Here's a diagram on the formation of free radicals. Affects the mitochondria. And here you could see it could be anything from cigarette smoking in the upper right to the air pollution with particulate matter we see out in the air we breathe in, to inflammation that affects our white blood cells, viruses, and so forth, and bacteria. And ultraviolet light. All these things can damage your DNA, and they cause the oxygen to combine with other substances and make free radicals which damage tissue. So avoid these substances that are noxious and toxic, like air pollution, avoid radiation, avoid smoking, avoid light, avoid infections, and keep your defense up with antioxidants, both naturally and even pharmacologically. So no, we embrace the pharmacology. We want our patients to take medicines to reverse a lot of abnormalities. My big thesis is, yes, let's lower the cholesterol with a statin, but there's a statin gap. 1/3 of patients might be protected. There's another 2/3 that are still vulnerable. How do we prevent that? Well, I think we have to prevent that LDL, that cholesterol that's lowered, then from getting oxidized. And then that's where you need the antioxidant mechanisms. And it could be anything from supplements to diet to exercise. You can get antioxidants in a lot of ways, and even some of the pharmaceutical agents. But you're absolutely right. We embrace the pharmacology.
So it's generally well accepted that medications tend to have more side effects than supplements, vitamins, and herbs. Let's not discount that supplements, vitamins, and herbs do not. They do and can have side effects. And they can also have interactions with drugs too, with medications.
Absolutely true. And that's why if you're going to take supplements, really check with your physician.
Yeah.
You shouldn't do it on your own. Yes, they're safe. Most of these are taken in high doses are safe, but they can interact with some medicines you're on, and at high levels they can do other things. So you really got to have a little bit of understanding. It's just not because you don't need a prescription to get them, they're 100% safe.
But what I also like about this complementary approach is, and I'll use this analogy, if a patient cannot get to a target goal of just say 40 milligrams of Lipitor to achieve that LDL status that you would like to see, and may develop arthralgias or myalgias, which are joint aches and muscle aches, you can then add this armamentarium to supplement, maybe maintaining them at a lower dose.
Absolutely. Absolutely, and it's a dose sparing of side effects. And a lot of my patients say, I can't go up on a higher dose, so maybe we could do something else in that cycle to ameliorate some of the risk factors. The other thing is a lot of oxidative stress on the brain and the neurological system is an area of big research. There's depression, anxiety, obsession, and obsessive compulsive behavior are all tied into reactive oxygen species and oxidation. And I see the psychiatrists pushing these high doses of psychotropes high, putting people on 1 and 2 and 3 medicines, and many times a matter of just using a low dose of one medicine and using a high antioxidant therapy to make improvement in some of these so-called psychological disorders, which may in essence be mitochondrial dysfunction or antioxidant mechanism dysfunction.
So we touched on traditional medicine approaches where we have a plethora of evidence-based medicine, usually with medications. We've also touched on the complementary approach utilizing alpha-lipoic acid, Lcarnitine, etc. What about diet and things that we eat? Like
Right.
the Mediterranean diet. What are antioxidants in these diets?
Well, first of all, what are antioxidants that we have access to? And the ones in the diet we have access to are products that have glutathione in them. Asparagus, for example.
Right.
Glutathione is a big antioxidant. Asparagus, walnuts, pecans, grape, spinach, tomatoes, garlic, great source of glutathione and antioxidants. Onions, even though some people don't react well to them. Kale, broccoli, collards, cabbage, avocado, a great monounsaturated fat, strong antioxidant with glutathione in it. Also, beets have a great, we talk about nitric oxide with beets, but also a lot of antioxidant activity. Both green and black tea have a lot of antioxidant activity. Spices like cinnamon, ginger, turmeric, which is curcumin, resorcinol we see in grapes and wine, nuts and seeds. These are excellent sources of antioxidants. Some of them, like the onions and kale, are high in sulfur, which are very helpful. So a lot of these are found in the Mediterranean diet. And what is the Mediterranean diet? Well, there's no one definition for the Mediterranean diet. Would you agree? There really isn't one definition. All we know is that people in southern Spain, southern Italy, and southern Greece don't get as much heart attack and cancer as people everywhere else in the world. So there's not really a definition for the Mediterranean diet. But there's three core parts of it. The Mediterranean diet is a plant-based diet. And we used to call it the poor man's diet. And Spain used to get insulted and didn't want to be called Mediterranean diet. They didn't want to get that association with the poor man's diet that you see in southern Italy and in Greece. But when we say poor man's diet, it doesn't mean that you have to be impoverished to be eating these. They're just things that are very economical. And they're plants. And there's three core food plants in the Mediterranean diet. The olive, the wheat, and the grape. And in 1975, Dr. Keyes did a 7-country study and showed for the first time how really that whole area, the Mediterranean basin, live long and don't get a lot of these problems. And so we said, well, what could be causing that? You know, what could be the things they're eating? We found out that the properties of the diet are very important. A lot of unsaturated fat and low saturated fat. They're not eating a lot of animal fats. They're low proportion of carbohydrates in the Mediterranean diet. It's a low glycemic index, so you don't get as much diabetes. The foods are not processed, they're unprocessed. Unlike us in this Western civilization, we're always eating unprocessed food. Right. There's high dietary fiber in the Mediterranean diet. A lot of antioxidant compounds is what we just talked about, and is very important. And along with antioxidant compounds, you have anti-inflammatory compounds, which enhance the nutritional adequacy, such as all these good micronutrients. And the Mediterranean diet has been shown to actually reduce cancer, cardiovascular disease in many studies. It's high in omega-3, it's high in alpha-linoleic acid, which is omega-3, not linoleic acid. And it's based on vegetables that are leaf and green, fruits, cereals like whole grain, legumes with a lot of fiber and protein like beans, and nuts, which are very important. Now, legumes are things like pods and lentils and chickpeas and beans and soybeans and peanuts. What they used to associate with the poor man's diet are really the longevity factors because of all the antioxidant and the helpful membrane properties that they provide. So the Mediterranean diet emphasizes the whole diet, not its parts. And there's a nice chart in a review article that shows each of these parts that I talked about, and we can show it up here. This review article shows that there's studies that show that each individual part is helpful, like the monounsaturated fats with olive oil and so forth. The nuts are helpful. The studies show they're favorable. All these factors in the Mediterranean diet have been shown to be helpful, but they all have to be taken together. Not one by itself is crucial. Now, olive oil probably is the most important because it has oleic acid, a polyphenol, which prevents the LDL particles from getting oxidized, and it's a monounsaturated fat. It gets in the membranes, makes them healthy, keeps the bad saturated fats out or the omega-6s out. And so I think olive oil, but by itself, you need more than olive oil. You need the grapes, the teas, the wines, even coffee and chocolate that are helpful. And the risk of diabetes goes down, the risk of heart attacks, the risk of various cancers, and some data shows in meta-analysis, which are big studies, Alzheimer's disease is delayed or prevented, and all different types of neurological diseases. So basically, that's what the Mediterranean diet is. It's a way of life with vegetables and fruits, low red meats, a lot of whole grains, fish over at other sources of protein. You don't eat a lot of refined grains, and you don't take things with a high glycemic index. You take things with low glycemic agent. And Levecki and others have showed that there's basically 12,000 cases of 20 cancer sites appear to be reduced when you have a Mediterranean diet. There's a lot of studies that are showing that, cancer, not just heart disease, is reduced. Going back to the 1999, the Lion study showed you could prevent, after heart attacks, you could prevent another heart attack if you take good dietary habits like this. So that, I hope it answers your question. There's no one diet, that there's no one substance, or there's no exact diet for the Mediterranean diet, but it's a complex of all those things that act in synergism. And one thing that we all know, it is compatible to, and it is comparable and compatible with the risk we see with aspirin, or the risk reduction we see in statins, the risk reduction we see with physical activity, with blood pressure medicines like ACE inhibitor and beta blockers. The Mediterranean diet gives you the same risk reduction as those pharmaceutical agents do, and it's complementary to it.
So often we talk the talk, but we don't walk the walk. So what I'm saying is, even as a provider and as a patient, we hear this, we read it, we run to Trader Joe's, we go to Whole Foods, we buy these foods, we get started, and then we peter out.
We peter out, exactly. But so, the people in southern Italy or Greece, they don't peter out.
They continue with it.
Yes, because that's their way of life.
Right. So my question is, what antioxidants are in your program, natural and supplementals?
Okay, well, that's great.
For people like us.
Okay. Well, obviously, the Mediterranean diet, we have a whole section as one of our 6 prongs. It's that important. Remember, if it's as important as aspirin and beta blockers and statins, it's important. So it's got its own category there.
Yeah.
So we tell all our patients to try to stay on a diet comparable to the Mediterranean diet. You lose weight, you prevent or control diabetes, you reduce this metabolic syndrome we have, and you have all your cancer and cardiovascular risk reduction data from epidemiology to go behind it. And also people that are on a Mediterranean diet, get all this antioxidant, they also are more fit. And it's probably a crucial part is the diet. But it's only one prong. We need 5 other prongs. So we got to go back to what reduces oxidative stress, which is antioxidants. What reduces it? Exercise, a great modality to reduce oxidative stress. Hence, if you don't want to increase your antioxidants, at least reduce your free radicals and so forth. We like exercise, and that's why it's one part. Stress, relaxation techniques such as yoga, another part. We use supplemental antioxidants like lipoic acid, and we're going to talk about that in detail, and coenzyme Q10 and Lcarnitine. We use those. Fish oils are great antioxidants that we use, along with the fruits and vegetables, to give it more potency and give natural substances that will go right into the mitochondrial mechanisms like the Krebs cycle, citric acid cycle, the electron transport chain, the glycolysis, all those pathways where we have metabolism and cellular respiration. The supplements we give are exact chemicals that you see in different steps. So it's not like we're giving a foreign substance, we're giving a natural substance that's already in the body. And of course, you got to take enough vitamins. Vitamins like C and E are extremely important. And other things not in our program that reduce oxidative stress are important, like flavonoids, but you'll get that in a Mediterranean diet, or zinc or selenium, copper. You'll get that through your diet, and that's important.
My personal experience with supplements is when starting them, I may not necessarily feel any better, but when I stop them, then I see a whole host of problems. So most recently, I had to get hip replacement surgery. I had to stop the fish oil 2 weeks prior to surgery. When I stopped it, my pain level was 30% worse.
Oh yeah, I mean there's so much anti-inflammatory, as we discussed in the earlier section on fish oil. The anti-inflammatory potential of that is great. It is the anti-inflammatory molecule of the membrane. Remember, we coined it that. You stop it and your inflammation is going to start revving up and you're going to start hurting. Same thing with these antioxidants. I take alpha lipoic acid and coenzyme Q10, and people can't believe I can work from 7 in the morning to 1 in the morning, midnight, 1 in the morning, non-stop. When I don't take it for a couple of days, I feel the difference, and then I think, why do I feel so petered out? And then I say, wow, I forgot my antioxidant for a couple of days. I mean, I could feel it. So there's no question about. Same thing with diet. If you go off of a good diet, you go on a good diet fad, you get fit. And you're taking a Mediterranean diet, you're going to Trader Joe's or these other places you mentioned, and then all of a sudden you go off the wagon. The holidays come or something, or you go on a vacation, and you can actually, then you feel the difference.
It's amazing.
There's no question about it.
No doubt about it. Dr. Depace, one more question I'd like you to expand on is, what reduces oxidative stress and what diseases are associated with it?
Okay, oxidative stress is reduced by antioxidants, so the diet's important, the supplements are important, exercise, relaxation techniques like yoga, all in our formula. Omega-3, very, very important. Nitric oxide, which we produce with our L-arginine compounds and L-citrulline and beet juice, extremely important as an antioxidant. Nitric oxide can actually potentially regulate lipid oxidation and cause anti-inflammation and lack of progression of atherosclerosis. Or, like I was saying before, if there's a lot of free radicals around, nitric oxide can combine with one, like a superoxide radical with a lot of oxygen around, and go the wrong route and form a perioxide nitrate compound which can damage cells. So how do you make nitric oxide do the good thing? Be anti-inflammatory, open up the arteries, vasodilate, and prevent atherosclerosis by being an antioxidant. How do you do that? And one way is you got to correct the milieu, the cellular milieu that's around. You got to have a lot of antioxidants around nitric oxide for it to go the right way. And that's one way. And the other way is you got to use antioxidants to sequester a lot of the reactive oxygen species because they're harmful. Other things that can actually modify or reduce oxidative stress are antidepressants, believe it or not. SSRIs like Prozac and Zoloft. Immunosuppressants can do it. Even corticosteroids can modify oxidative stress. There's anti-tumor factor antibodies and various metals that can do it now. But what diseases are implicated in oxidative stress? Well, atherosclerosis is really our model because you get the oxidized LDL goes into the foam cells. So we know atherosclerosis, stroke, heart attack is a disease that involves oxidative stress. Colon cancer, rectal cancer is being investigated as a significant target for oxidative stress, as is inflammatory bowel disease. There's many peer-reviewed articles written in this area, especially in psychology, like depression, anxiety, obsessive-compulsive disorders. They're showing high evidence of reactive airway oxygen species in those disorders by blood testing and different types of modalities. Blood pressure, cancer, neurological diseases, asthma, emphysema, diabetes, all of these have been linked to oxidative stress. Asperger's disease, ADHD, attention deficit diseases, and heart failure, especially Alzheimer's disease, another one. Chronic fatigue with the mitochondrial disorders, oxidative stress, very strong association being shown. Also autism, Parkinson's disease, various infections, and even fibromyalgia, which is a very common problem. The aging process itself is an oxidative stress problem, where oxidative stress takes the wear and tear and leaves hag. As we get older, we get more oxidative stress, and it promotes aging or senescence. So oxidative stress is down right at the root of a lot of these disease entities, which you were talking about before. We've got to look at the biochemistry down at the molecular level.
Dr. Depace, what specific supplements are you using in your program?
Well, in our program, we use, we talked about the omega-3, which is extremely important, whether you take fish or take the supplements, and we like to use a hybrid of that. But we also very much like to use coenzyme Q10. We like to use alpha lipoic acid, and also Lcarnitine in the program.
I hear a lot about coenzyme Q10, read some articles out of Japan that they used it intravenously for patients with congestive heart failures and how it repaired the heart. Could you expand on how you're using coenzyme Q10 and how it affects the mitochondria or the body on a cellular level?
Yes, coenzyme Q10 is a natural substance in our body. It's the only lipid-soluble antioxidant which is produced inside our own cells and can be regenerated. And what it does is it prevents in the mitochondria the reactive oxygen species and free radicals that combine with oxygen to cause damage. So it does two things which are really important. Not only does it protect the cell membranes from the oxidation, and it protects the mitochondria, but it also inhibits the circulating cholesterol particles, the lipoproteins, from getting oxidized and going into foam cells. So it helps what's in the bloodstream, the lipid particles and lipoproteins, from getting oxidized, and it helps what's in the cell, that mitochondria, from getting damaged by producing reactive substances with oxygen, because it's a great antioxidant. So the fact that it's produced in the body is important. And your question is very good. Let's look at the biochemistry. If we look at this diagram over here, when you come off the citric acid cycle or the Krebs cycle, which we saw before, that circle, you get the electron transport chain where a lot of the ATP is produced and oxygen comes in and water comes out. And what happens is electrons are carried along this chain as they become reduced, adding electrons. And there's two major complexes, complex 1 and 2, that require a cofactor to move these electrons along to factor 3 and factor 4 before your ATP or energy molecule is produced. And that is the coenzyme Q10. So coenzyme Q10, as you can see here, has a pivotal location, the actual lipid-soluble molecule in the body. So it's not a vitamin because it's made by the body. It's not taken exogenously. When something's made by the body, it can't be a vitamin. It's an actual cofactor, coenzyme in the electron transport chain. It helps move the electrons along to produce the ATP at the end. And of course, we get water when oxygen comes in. So it's an intracellular membrane stabilizer. And what's interesting is coenzyme Q10 is called ubiquinone because it's a natural redox substance that's found everywhere in the body. And there's a reduced form called ubiquinol, which also works well as an antioxidant. So it's actually probably absorbed a little better and it functions a little quicker. So when people get deficient in coenzyme Q10, what happens? Well, the mitochondria energy goes down. You don't produce the ATP. If you don't have coenzyme Q10 and you get deficient, you're not going to produce as much energy. And you lose your antioxidant capacity. So it helps the mitochondria stay healthy because it's part of the mitochondria to make the energy molecule. We've seen in some associations with depression, migraine, chronic fatigue, menopause, fibromyalgia, that the coenzyme Q levels are low, or there's a problem with the mitochondria. And we're starting to look at these as mitochondrial disorders. And so when I see patients come in with a lot of these dysfunctioning disorders, I believe they could be coenzyme Q deficient and start giving coenzyme Q10 just based on my instinct. So it fights against free radicals, which cause oxidation. You can get it now from beef, poultry, fish, herring, trout, uncooked spinach, uncooked broccoli, or cauliflower, but you only take 3 to 5 milligrams a day in a diet. So I think supplement, we feel, is the best way to get a good dose of it. And you can measure it in the bloodstream. You can actually measure levels of it in the bloodstream. Now, some people say, well, that's a little tricky because most of coenzyme Q10 is carried by the lipoproteins in the cholesterol molecule. But they found in studies that the blood levels can be helpful and show you some valuable things. And people have taken up to 12 to 2,400 milligrams a day of it and found it to make them helpful, but we don't use doses that high. Usually we use 200, 300 milligrams a day in that regard. Another important property of coenzyme Q10, it can actually regenerate and recycle vitamin E, which is a lipid-soluble antioxidant vitamin, and vitamin C, which is a water-soluble antioxidant. And so therefore, coenzyme Q10 is valuable in recycling those two vitamins in our body. Coenzyme Q10 also makes nitric oxide work better, because what it does is it prevents that nitric oxide from getting oxidized and going to perinitrate and causing cell damage. It makes the nitric oxide go right to the smooth muscle and relax it. And some studies have shown as much as a 17 millimeter drop in blood pressure with coenzyme Q10, an excellent blood pressure lowering agent in some areas. Because of the nitric oxide, it increases the efficiency of it. So it has a good effect on endothelial function. It has a good effect on lipids, and it's especially been used in heart failure studies. Even though they're small, there's very favorable information on it in heart failure, also in Parkinson's disease, and other cardiac diseases, migraines, depression, chronic fatigue, and autonomic dysfunction, cognitive diseases. There have been many studies that have been showing favorable effects with coenzyme Q10.
Dr. Depace, my next question is about chronic fatigue syndrome, and as well as statin therapy and arthralgias, myalgias, muscle aches. One in particularly, there's a lot of talk about chronic fatigue syndrome and viruses, and you're saying mitochondrial injury may be the source. The other is with statins. Personally, I've tried every statin that's on the market, and every statin gives me myalgias, arthralgias, and I can tell you why. Because when I remove it, it goes away, and when I restart it, it comes back. Can you share your experience with coenzyme Q10 and these two problems that exist?
And let me tell you, a good high percent of my cardiology practice has to do with people with chronic fatigue and people that need statins that just can't tolerate them and they ache all over, despite trying one after the other after the other. First, with chronic fatigue. There has been shown in one study that up to 97% of people with chronic fatigue have something called orthostatic intolerance, meaning when they stand up, they get brain fog, they get tired, dizzy, exhausted, and they got to lay down, they feel better. And we know there's an association between mitochondrial diseases and autonomic dysfunction. And that orthostatic intolerance, standing up, getting tired like that, is really a measure of autonomic dysfunction. Studies have shown that treating some of these patients with coenzyme Q10 may help that. Now, mitochondrial dysfunction, you can measure, has a lot of reactive oxygen species being generated. And this is what we think happens in chronic fatigue and also fibromyalgia. Coenzyme Q10, an excellent antioxidant, is showing some promise as a treatment in these disorders along with other things. And same thing with POTS syndrome, which is postural orthostatic tachycardia. People stand up, their heart rate pounds, they get woozy, they got to sit down, lay down. That we believe is a mitochondrial dysfunction. Now, is it a virus like Epstein-Barr? We now know it probably isn't a virus. That is the main cause of these chronic fatigue syndromes or some of these autonomic dysfunction syndromes. But we think it's a mitochondrial susceptibility to some kind of a stress, whether it's a virus, a concussion, a trauma, emotional stress, or something in that regard. And coenzyme Q10 is an antioxidant, hopefully will stabilize the mitochondria in some people and reduce those oxygen radicals and swing the pendulum more towards the buffering effect of antioxidants rather than the damaging effects of free radicals. Now, in terms of the statin situation, people that take statins for cholesterol lowering do get coenzyme Q depleted, because the tail of the coenzyme Q molecule is in that mevalonic pathway where cholesterol is formed. So the coenzyme Q10 is formed, part of it is formed in that enzyme pathway that actually makes cholesterol. If you block those enzymes, especially the rate-limiting enzyme in cholesterol synthesis, HMG reductase enzyme, if you block that with a statin, you're also not only going to block the production of the cholesterol, which you want to do, and lower the cholesterol, but you're going to block the tail part that goes on to alpha-lipoic acid. And therefore, it makes sense that people get depleted coenzyme Q10 and they get muscle aches, and that is a problem. I like to start my patients with high-dose coenzyme Q10 before I start a statin, and I've seen that they get a better benefit and can tolerate them. But there are some people like you that still don't get benefited from it, and in which case we have to go to other statin alternatives. There's injections now you can take to lower your cholesterol with certain products. There's other pills, there's powders, there's Zetia, there's Welchol. There's some of these PK inhibitor injections you can take twice a month, which are very good to work off the receptors to lower your cholesterol. So thank goodness there are other ways to lower cholesterol. But remember, it's not just lowering your cholesterol that's important. We've got to keep it from getting oxidized. And that's where I like to use antioxidant therapy to complement the pharmacology that lowers cholesterol. So unfortunately, you appear not to be benefited from the. Some people are just refractory, and it's a hit or miss thing. And some people with the coenzyme Q10 will be able to tolerate the statins. But I started several weeks in a high dose before they even start the statin, so they never hit zero on their levels of coenzyme Q10 in the blood, which I told you, obviously, we can measure those, period. It's interestingly that in mitochondrial dysfunction and chronic fatigue syndrome, 57% decrease in coenzyme Q10 was noted in the mononuclear cells when we studied them. Same thing with people on statins. We measured them and the blood levels of coenzyme Q10 are markedly down. So we know there's a depletion of coenzyme Q10, and this affects the mitochondria, whether you get muscle aches from statins or whether you get chronic fatigue or fibromyalgia from other illnesses. And another reason why we like coenzyme Q10 in our armamentarium.
So Dr. Depace, we spoke a lot about coenzyme Q10, omega-3, alpha lipoic acid. We touched a little bit on L-carnitine. I know L-carnitine affects the mitochondria, which is so important. How does it affect the circulatory system in general?
Okay, well, we'll start from where is L-carnitine important. L-carnitine is important. It works in the matrix of the mitochondria. And what it does, if you look at how fatty acids get oxidized and broken down, they have to go inside the mitochondria, the matrix here, to get broken down to a 2-carbon fragment, acetyl-CoA, which goes through the Krebs cycle or a citric acid cycle and generates ATP, and then you get your electron transport chain. So how do we get these fatty acids broken down, these long chain ones? You got to get these long chain fatty acids broken down, and then they have to be transported from the cytoplasm to inside the mitochondria by L-carnitine, and we call that the L-carnitine shuttle. It's the rate-limiting step in fatty acid oxidation. Once the fatty acids, the triglycerides and so forth, are brought into the mitochondria, they are broken down 16-chain, 18-chain, 20-chain carbon atoms are broken down to 2-carbon atom, acetyl-CoA, which goes into this cycle here, and carnitine is very important for us to oxidize, get energy out of the fatty acids and glycerol. So that's where it's very important in the mitochondria. And a deficiency of it can cause a lot of problems. Now, in terms of the circulation, all roads lead to Rome, we talked about. And we've also found out that in addition to increasing mitochondrial function, increasing ATP production by getting all these fatty acids oxidized and moved into the mitochondria, L-carnitine can also increase nitric oxide signaling, which is important. And it also improves endothelial function. Unfortunately, taking it orally, it has a poor bioavailability, so it's not as great of an oral agent, but it does work. And there's a glycine type a propionyl derivative of L-carnitine that actually has been used in studies, and they showed in 26 athletic males, if you give 3 to 4 grams a day, you put them on a treadmill, that their nitric oxide levels actually went up. Some of the antioxidant things we measure in the blood, we call TPARs, they go down. And that was published in 2015 in the sports journals. And so L-carnitine has been shown to increase nitric oxide, not just in animal models, but also in humans. Also, L-carnitine is anti-inflammatory. It's not just an antioxidant. It actually decreases something called NF-κB, which is made by scavenger cells, and it decreases inflammation that way. So it's actually a very important molecule, not just for fatty acid oxidation, which generates ATP and energy in the mitochondria, but also in keeping the blood vessels open, and it's helping nitric oxide signal and improving endothelial function. Now, it's been labeled as a fat burner. It's made in the body by lysine and methionine, so it is made in the body, L-carnitine. But people have been calling it a fat burner. And if you really look at it, it makes sense why it could be called a fat burner. It helps you oxidize all your fats, fatty acids, brings them into mitochondria, and you get ATP produced. But in reality, it's not a great fat burner unless you're L-carnitine deficient. If you're normal, it's not going to burn fat. So we don't really recommend it as a fat burner or weight loss in the majority of people if they don't have a deficiency of it. We do recommend it as for mitochondrial wellness. If we suspect a mitochondrial disorder, we like to use it. And if we believe that, and we also believe that it's healthy for the endothelial system because it promotes the nitric oxide signaling. So we believe it has multiple advantages as an antioxidant. And we see it as an anti-inflammatory. So L-carnitine is part of our protocol that we recommend to a lot of our patients.
Dr. Depace, when I think personally of alpha-lipoic acid, I think about peripheral neuropathy. However, my understanding is that alpha-lipoic acid goes far beyond peripheral neuropathy in treating other issues that we have a problem. It goes to the mitochondria. And if we can augment its effect on the mitochondria, then we can broaden its effect in the body. What is the autonomic nervous system in relationship to what we've been talking about, and how does alpha-lipoic acid fit into that?
Yeah, that's an area that's extremely important. Remember we said that a lot of these mitochondrial dysfunction disorders are somehow linked with the autonomic nervous system function. We don't, and we believe it has to do with high sympathetic stress. When somebody gets a stress on them, the mitochondria get stressed. The sympathetics go up. Now what comes first? The sympathetics go up and it influences the mitochondria or vice versa. There seems to be some connection between autonomics and mitochondrial function, and sympathetics go up with stress, which, and I'm going to explain what that means. The autonomic nervous system is the part of the body that controls things you don't think about. You don't think about digestion. You don't think about your heart beating. You don't think about breathing. You don't think about your blood vessel tone going up or down, your blood pressure going up and down. While we're talking, our autonomic system is working continuously. And there's two major parts. The sympathetic nervous system, which comes from the brain to all the organs, is the adrenaline, is the norepinephrine. It's the part of the nervous system that we consider the accelerator of the body, like a car has an accelerator. And then you have the parasympathetics, which are the brakes. Right. So you have the brakes, which slow things down, slow digestion down, slow the heart rate down, and slow metabolism down. The sympathetics rev things up. They're more of the accelerator. So we like to see them in a balance. So in a nutshell, the autonomic nervous system is that part of the nervous system which controls things we don't think of. Now, in contradistinction, the peripheral nervous system are the nerves that, for example, go to your feet when you get numbness when you're diabetic or you get pain. That's peripheral nervous system symptoms. Interesting type C fibers are involved in that, and type C fibers are found in the autonomic nervous system. So some of the medicines we use, like alpha-lipoic acid, we feel are helpful with these type C fibers, can help both the peripheral nervous system and can help the autonomic nervous system.
What type of specific diseases affect the parasympathetic and sympathetic nervous system, and how are they treated in traditional medicine?
Okay. Well, we like to get a balance between the sympathetics and parasympathetics, like a one-to-one balance. Right. When the seesaw goes up this way, the parasympathetics may be too high, and we'll get parasympathetic type disease entities possibly induced. When the seesaw goes up this way, you get too much sympathetics. Now, sympathetics are fight or flight, so you're going to get arrhythmias with a lot of adrenaline. And when the parasympathetics up, you may have the brakes on all the time. You may get chronic fatigue being manifested itself, fibromyalgia, depression, and things like that. Now, if you look at this slide here, autonomic dysfunction involves very common illnesses. Chronic fatigue, for example, we see a lot of times the vagus nerve is revved up in that because of the slowing down process. Fibromyalgia has been linked. Now, these are also linked to mitochondrial disorders. Remember, I tell you there's a one-to-one relationship, or I wouldn't say one-to-one, but there's a relationship, we believe, between mitochondrial disorders and autonomic dysfunction. Migraines have been linked to the autonomic nervous system malfunctioning. Gastroparesis, when you throw up a lot, you vomit, you're nauseous, you get full real quick with early satiety. Also linked to autonomic nervous system. Irritable bowel syndrome is a classic case of irritable, of autonomic dysfunction. Also, gastroesophageal reflux disease. So a lot of GI disorders are due to autonomic dysfunction. Chest pain, palpitation, shortness of breath may not be due to a cardiac condition, but to a condition affecting, for example, the sympathetic nerves that go to the heart. We see that in people with POTS syndrome, postural orthostatic tachycardia. Brain fog, when people stand up and get this orthostatic intolerance and they're always cloudy and they got to lay down and they're always in a fog, also has been shown to be have an autonomic nervous system etiology, dysfunction etiology. Same thing with postural symptoms of dizziness, dropping your blood pressure when you get out, passing out, or fainting is a very common cause of autonomic dysfunction. Other things can cause fainting that are serious, like arrhythmias. That's not autonomic dysfunction. There you got to make sure the heart's okay, or a problem with the brain, or circulation to the brain. After you rule that out, look at the autonomic nervous system and see. Oftentimes there's a lack of sympathetic flow when you stand up causing it, or a high vagal tone causing a vagal syncope, precipitating it. We have ways to test this with autonomic testing. We like to look at cardiorespiratory testing in our laboratory with coupling the heartbeat with the respiratory cycle, and we can make great assessments with that. Some people like to use tilt tests, which I'm not a big fan of because it's not as sensitive or specific, I believe. But there are different testing modalities that can be used, time domain analysis and so forth, to give us an idea what's not working in an autonomic nervous system. And of course, various neuropathy syndromes are linked to autonomic dysfunction. So autonomic dysfunction is very common, just like mitochondrial disorders are common, and we believe they're linked together. And when you can't find a diagnosis on a patient, sometimes it's simple. Just think autonomic dysfunction or think mitochondrial dysfunction. Start keying in on that and don't say, well, it's all in your head. It's all psychological, because that don't hold water. When people are sick, they know they're sick.
Exactly. So my question is the autonomic nervous system, the parasympathetic, the sympathetic, you're stressing the importance of it, but most physicians don't look at it like that. And why is that? Why not? Why don't we look at it?
Because we haven't been educated. It's simple. I mean, I never got education beyond the basics about parasympathetic and sympathetic function. I just wrote a textbook with 3 other leading fellows by Springer about a year and a half ago, a 500-page textbook, and I did a lot of the cardiac section. And in that textbook, we were trying to show doctors, physicians, it's written for doctors, to be aware of how this works, how there's got to be a balance, and how a lot of diseases, which we just say it's in the patient's head or it's functional, really aren't functional, that they're due to stresses that have been inflicted on the autonomic nervous system, and one part malfunctions. And there's training and exercise and cognitive behavior and pharmacology and techniques we can do, and supplement techniques that we can do to try and normalize it and get the patient back to the midline a bit. And it takes a little bit of work. They're not easy disorders to treat, but they're real entities. So parasympathetic, sympathetic autonomic dysfunction, doctors just haven't been trained in it, And you think about it. For example, orthostatic hypotension, where you stand up and your blood pressure drops. Orthostatic intolerance, when you're standing in line or going to a supermarket, you get brain fog and you got to sit down. Exercise intolerance, you get tired real easy, but you got a normal heart and normal lungs. You can't do much exercise. Abnormalities of sweating, too much sweating, too little sweating. People with digestive difficulties, irritable bowels and heartburn and gastroparesis, vomiting and nausea that they can't find a reason for, oftentimes autonomic dysfunction. Dizziness or fainting or near fainting many times is just autonomic dysfunction abnormalities, and we can identify them and treat them instead of just watching a patient every day and not knowing what's happening, when they're going to pass out. Nerve neuropathies, including diabetic nerve pain, common cause of neuropathy in diabetics. Also, diabetics get autonomic neuropathy. So these are the things that are that we zone in on.
We talked about how important mind-body is with regards to functional medicine, holistic medicine, complementary medicine. We know that the parasympathetic, sympathetic system, autonomic nervous system fits right in with that. From a cardiovascular perspective, I'm getting the impression that there's a link between the brain and the body. My question is, how do you, and how has this changed the way you're practicing medicine, this brain-body?
Right. I don't treat the organ system that's dysfunctioning. A patient comes in with stomach pains, I just don't treat the stomach, or they're vomiting or nauseous. You got to treat the brain and the stomach. Patient comes in with heart problems, even atherosclerosis.
Right.
You got to treat the brain and the heart because the brain, the sympathetics and the parasympathetics go to the heart and innervate it. You cannot treat one organ system in isolation. You have to look at what innervates it, and we look at that. And that's why, working with the brain, cognitive difficulties, and Alzheimer's, and Parkinson's, neurodegenerative diseases, yes, they're central nervous system or brain problems, but also you got to go into the cellular level, another level. You got to go into the cellular level, look at the mitochondrial dysfunction possibilities, and we got to look at the whole person, look at each organ separately, put organs in combination, treat 2 organs, 3 organs, some systems sometimes, look at the autonomics, and then start thinking, like you say, about functional medicine. And that's why the program we designed, which we feel is healthful type program, healthy program, emphasizes many of these features.
So my question is, what exactly is alpha-lipoic acid?
Okay, alpha-lipoic acid is really one of the strongest antioxidants known to man. And what it does is it repairs proteins that get damaged or oxidized, so it repairs. It prevents damage, it ties up and sequesters oxidating agents or free radicals. And it also, interestingly, aids in the regeneration of other antioxidants that help us. It enhances the vitamins C and E, for example. It also helps hormone balance, aids in stress resistance, aids in cardiac function, and helps the immune system get better. But what exactly is it? Well, it's interesting. It's both a lipid and water-soluble substance. It's not a vitamin because it's actually produced in our own body, so it's not a vitamin. It virtually has no side effects. It was isolated in 1951 by a PhD by the name of Lester, and he isolated it and found out that it could dissolve in lipids, and he called it lipoic acid. But then they also saw the sulfur groups on it, and they called it thioctic acid. So you'll see both names oftentimes. Thio being for sulfur, octic for Greek in sulfur, so it's a sulfur name. It's a coenzyme, and what it does, where L-carnitine burned fats, or look like it would oxidize fats, it's not really a fat burner, where it takes fat off your body, but oxidized fats, alpha-lipoic acid helps burn carbohydrates. It is the cofactor. It is the molecule that will bring in the glucose products into the mitochondria so we can oxidize them, burn them, and get water and ATP molecules off. So if you look at this figure over here, you can see that glycogen gets broken down with glucose to pyruvate, to acetyl-CoA and citric acid. The step right in here where pyruvic acid gets broken down to acetyl-CoA in the mitochondria, there's an enzyme complex called pyruvic dehydrogenase, and lipoic acid is right at the middle of it as a cofactor. Lipoic acid is extremely important, and this shows it very nicely. Before you go into the Krebs or citric acid cycle, pyruvate goes to acetyl-CoA. You need all these B vitamins and lipoic acid to get it in here. Also, lipoic acid is down here in the Krebs cycle, where alpha-ketogluteric acid goes to succinyl-CoA. Lipoic acid with the same B vitamins is here as a cofactor. So it gets sugar into the cell in the mitochondria to get oxidized and burned to produce our energy ATP. And it also helps crank around this cycle in the enzyme pathway here. And there's some other areas lipoic acid is found. Extremely important in metabolism. It's a key cofactor. In fact, if you take arsenic, arsenic will tie up lipoic acid, and that's its mechanism of lethal death. Arsenic death is due to the fact that it ties up lipoic acid. That's how crucial lipoic acid is.
You did mention that the alpha-lipoic acid is one of the most powerful antioxidants. When I think of a powerful antioxidant, I think of vitamin C, Dr. Linus Pauling. Okay? Can you tell me what the difference is between alpha-lipoic acid and vitamin C?
Yeah. Vitamin C and vitamin E are salvage antioxidants. They are also very strong and very powerful. But we believe, vitamin C maintains the mitochondrial levels, normal levels of glutathione. It's necessary for collagen synthesis. And vitamin E prevents the oxidation of LDL. It protects against cigarette smoke, radiation, cancer, chemotherapy, and all that. Alpha-lipoic acid does both of those things. Not only does alpha-lipoic acid do both of those things, but alpha-lipoic acid is an excellent chelating agent. and also it recycles vitamin C and vitamin E. So that is a crucial thing. It acts as an antioxidant, but it also salvages antioxidants. It actually recycles vitamin C and vitamin E so they continuously be used. So that's why it appears to be more potent. Now, like anything else, you got to use things in combinations. If you don't take vitamin C and vitamin E in your diet, in your body, because you don't have them, you're going to suffer from antioxidant deficiency.
Right.
But thank goodness if you do take them, if you have alpha-lipoic acid floating around, it's going to help recycle them even more. So to answer your question, they're all important, but alpha-lipoic acid is extremely important, and it's also anti-inflammatory, which the other vitamins don't appear to be as much. It decreases this NF-kappa transcription factor, and also alpha-lipoic acid lowers sugar, and it makes insulin less resistant, so it has a sugar lowering effect. You got to be careful. You can't take it with too many diabetic medicines. It might bottom out your sugar. Right. You have to check with your doctor. It can interfere with thyroid medicine, chemotherapy medicine. So alpha-lipoic acid is a potent antioxidant and does interact with other medications. What I like about alpha-lipoic acid has been shown to increase acetylcholine. And you know, in the autonomic nervous system, sometimes our acetylcholine levels get devastated, and there's data that shows that it helps increase acetylcholine levels, and as you mentioned, it also is very important in neuropathy conditions, and there's been some nice interesting studies on that, in addition to stabilizing cognitive dysfunction and things like Alzheimer's disease and so forth. So we like alpha-lipoic acid. It has so many beneficial effects. It even lowers the lipids in your liver, so we're starting to look at it, treating it for fatty liver, which we really don't have a good treatment for. It's just a very, very useful molecule, and like I said, it increases energy because it makes the mitochondria produce more energy by bringing glucose through the whole cycle into the cell mitochondria.
Interesting, you mentioned parasympathetic nervous system, sympathetic nervous system, autonomic nervous system. When I think of a nervous system, I think of a neurologist. Why is a cardiologist interested in this?
Because the neurologist, in many instances, just treat the brain and the nerves. And a cardiologist has the ability to treat the heart. Now, I'm being biased. I'm sure I'm going to be criticized for the statement. Treats the heart and the blood vessels, but also treats the lipids, so they don't get oxidized. Also treats the brain and the parasympathetic and sympathetic nervous system. Also treats the kidneys with the hormones that are secreted from the kidneys and adrenal glands, which affect your blood pressure and your blood flow. And it all comes down to circulation. Circulation to the brain, to the neurons, to the small nerve fibers, to the heart. If the circulation, if you're getting blood flow, you're going to keep those organs healthy. You're not going to age as quick and degenerate as quick. And that's why I think that cardiologists have a better handle on this than the neurologist does. Right. And notice in our textbook, we didn't have any neurologists really contributing as much as you would have thought. Well, that book should have been written by a neurologist. It was written really by a PhD, and an endocrinologist, diabetologist, and a cardiologist, two cardiologists. So that's an excellent question, and I don't think the neurologists focus on the autonomics. They certainly don't function on the mitochondrial dysfunction in the cellular level, and they don't function as much as we do on the cholesterol, not just only being lowered, but keeping it from being oxidized. And the nitric oxide is a key thing that's very important. That has to be, and cardiologists really are sensitized to nitric oxide, keeping the levels up and keeping the antioxidant levels down, so nitric oxide will work well in that milieu.
So my other question is, if the parasympathetic system, sympathetic nervous system, control the heart, how do you measure this? How do you know if it's functioning properly?
Yeah. We like a technique called cardiorespiratory testing, which was developed at MIT and Harvard with a protocol back in the 80s, where we can get an idea of coupling the respiratory cycle with the heartbeats on an electrocardiogram and doing measurements through a computer, how both of those factors are working. We have surrogates for parasympathetic and sympathetic activity, and we test for it. And we can get some ideas about how those units are functioning, what kind of ratio they're in, which one's more predominant, which isn't. We do certain maneuvers. We do Valsalva. We bear down against a closed glottis. We do standing techniques. We do deep breathing techniques, and we try to provoke them. And sometimes we do a tilt test where we put a person on a 45, 60-degree angle. We give them medicines like nitroglycerin and see what that does. So we have all types of techniques We do beat-to-beat blood pressure analysis, and we can get an idea of how these autonomics are going. The tougher things is identifying autonomic dysfunction isn't as hard, treating it is more difficult.
Right.
Once you identify there is an autonomic problem, it's sometimes very difficult to treat. It takes a lot of effort, a lot of time, a lot of conscientiousness, a lot of tedious, laborious effort.
Dr. Depace, my next question is, how do you think that alpha-lipoic acid works in the autonomic dysfunction?
It probably works at various levels. Obviously, one would be the antioxidant level, which we just discussed. It also is anti-inflammatory, and it's been shown to interfere with the degenerative cycle of inflammation that destroys brain cells. And these brain cells make acetylcholine, which is a very important transmitter in the autonomic nervous system. And parasympathetic neurons especially need to make acetylcholine, and alpha-lipoic acid appears to interfere with these inflammatory proteins that can actually destroy brain cells and destroy the acetylcholine. And we're starting to see possible potential use for it in neurodegenerative diseases like Alzheimer's and Parkinson's because of that. So alpha-lipoic acid inhibits free radicals, which damage DNA. It produces more energy for the cell, and it appears to knock out these inflammatory proteins that can damage the nerve cells. I think these are all mechanisms of how it benefits autonomic nervous system.
Yeah, but does it affect autonomic cardiac dysfunction? How's it work here?
Okay, that's a great question. Alpha-lipoic acid has been worked on in various autonomic states, including diabetics. And there's been a little bit of work in cardiac autonomic neuropathy. Well, what is cardiac autonomic neuropathy? Cardiac autonomic neuropathy is the worst type of autonomic neuropathy you can have. It's the most severest because it could be life-threatening. It could predispose you to arrhythmias like sudden cardiac death, for example. You get higher stroke incidents, higher heart attacks, because you don't have enough brake or enough vagal mechanism. For example, you get an arrhythmia, you need the vagus nerve, you need to slow it down. You don't have a braking mechanism. And in cardiac autonomic neuropathy, we see very low levels of activity in the nervous system, very advanced, very low vagal nerve discharges and so forth. And that's pretty much an advanced stage. We like to treat autonomic dysfunction before you get to that stage in a preventative modality or an avoidance modality if possible. And alpha-lipoic acid has been shown, because it's a strong antioxidant in some studies, especially in Germany, to help diabetic neuropathy symptoms. For example, one study gave it IV 600 milligrams intravenously and showed after 4 months it improved cardiac autonomic dysfunction and non-insulin dependent diabetes. That was published in 1997 by Ziegler. That was the intravenous form. Then oral treatment for 5 weeks appeared to improve symptoms in distal polyneuropathy in diabetics in the sensory nerves, and that was shown by Ziegler. And it's been shown in other sensory and motor neuropathies to be somewhat beneficial in painful diabetic neuropathy. And there was a study by Tankova where alpha-lipoic acid in diabetics, it was a controlled randomized open label study in 2004, looked like it slowed down the progression of autonomic neuropathy. So there have been some data that are being accumulated. Some studies have shown up you need for diabetic polyneuropathy up to 600 milligrams 3 times a day. So high doses may be effective in these real severe forms. But there is data that shows, and we're starting to investigate it in our laboratory, alpha-lipoic acid is very effective in various neuropathy states in helping them.
The supplement Cardio Neuro Plus, what other ingredients are in that besides alpha-lipoic acid?
In the Cardio Plus component, you use alpha-lipoic acid with coenzyme Q10. We like to think of it as a mitochondrial stabilizing natural substance, because those are enzyme cofactors in the mitochondria. There's some folic acid, I believe, in it, and some vitamin B's. There may be some magnesium. I'd have to check the label, but those are the main products that we like to use in a cardio-neural product that we feel will be helpful to patients.
And we also know that nerves are very sensitive to lack of blood flow, and I know you have companion supplements to help with heart and blood vessel health. Why not put all the ingredients in one pill?
Yeah, that would be tough because you don't have enough space in one pill to put everything. So the fish oils also, they're difficult to mix with some of these substances. They have to be kept separately, omega-3, because it's an oil. The alpha lipoic acid goes well with the coenzyme Q10, and we give a little. I would have to look at the labels, but I think there's a little vitamin E in there, and there are some, I believe, folic acids in that one, and like we talked about a few other things. I know vitamin D you could put in that. And in terms of the nitric oxide compounds, they seem to go better in a powder because they mix better. You could put them in a powder, for example, the Lcarnitine, the L-arginine, even the L-citrulline, and the beet juice you could put in a powder. You could put all those nitrates, and they seem to mix better. So that's one of the reasons we keep them to 3 separate products. A nitric oxide type product, a nerve mitochondrial type product, and the fish oil, like right in the middle as the apex of the triangle. And that's what we sort of do.
How do all the companion supplements work together?
Well, the main thing, they work together to enhance endothelial wellness, we believe, and also mitochondrial wellness and nerve fiber wellness, especially the small seed fibers. We feel they have beneficial effects on those. They promote nitric oxide, and also the antioxidants promote nitric oxide. Hopefully we push it more towards the vasodilating effect and away from forming free radicals. So we like to keep an antioxidant balance so that we have a good buffer system against free radicals and damaging oxidative substances. And we like to keep nitric oxide around to keep the blood vessels healthy. Let's not forget the LDL cholesterol. We got to keep that low. Whether you take statins, a Mediterranean diet, Zetia, all these other products, Welchol, any of these products that lower cholesterol, we got to keep the LDL particle count low. It's very crucial to keep the number of LDL particles low. We like the LDL's levels low. We like the LDL particle count low. That's the lousy cholesterol. That's what the L is for. But we want to keep it from getting oxidized. Exercise, nitric oxide, fish oils, the right diet, the right weight, stress reduction, some of these coenzymes we've talked about, hopefully will keep those LDL particles, even when they're low, from getting oxidized, so you got a double bonus. Keep the particles low, and then keep them from being oxidized.
So I'm young and healthy, but you may say that I still have an imbalance of my parasympathetic and sympathetic nervous system. I'm symptom-free, but I still may have an imbalance. Do I still continue to take these supplements?
In my experience, if you're feeling well, you don't have any of those dizziness, exercise intolerance, orthostatic symptoms, no fainting, no chronic fatigue, no fibromyalgia, muscle aches, migraines, uncontrolled blood pressure you can't control. Generally, you're autonomic and you're young, you're autonomic. Most people I test are pretty normal, believe it or not. And so we just tell them to live a nice lifestyle. You don't need to go with an aggressive program with alpha lipoic acid and these other things. Now, the patients that have symptoms, a lot of symptoms, we usually do find abnormalities in them when we test them, and that's when we get more proactive and use antioxidants like coenzyme Q10 and alpha lipoic acid for the autonomic patient dysfunction. So it is a clinical judgment, but young healthy people, for example, don't respond to L-arginine. They don't need L-arginine to increase their nitric oxide. Now, if you give them beet juice, it goes through the mouth to saliva. That'll increase their nitric oxide through nitrates. That may help them exercise and increase their exercise tolerance and do better exercise. But for the most part, people that are young and healthy, I think if they stick on a Mediterranean diet and they exercise and they do stress reduction, they'll be getting the better part of this program. It's as you age and as you become more vulnerable, that you may need a little supplementary help in here, and that's where this is more designed for the person over 30, I think. Not for the person below 30, unless, like you said, they have symptoms and signs of, for example, autonomic dysfunction or premature vascular disease or something like that, or premature cholesterol disorder like a familial hypercholesterolemia where their cholesterol levels are through the roof. This is something you may want to consider then.
Dr. Depace, let's not underestimate the power of exercise. I can tell you personally, when I'm on target, when I'm doing it, I feel great. When I have a setback that I stop, things go to pieces. Tell me how it works, the mechanism of it, down to maybe a cellular level, a parasympathetic, sympathetic system, how it fits into this whole picture.
Yeah, exercise is better than any pill you could take, any supplement you could take, any medicine you could take. and complements diet, a good diet. It's a lifestyle change or lifestyle habit. Exercise decreases heart disease, decreases obesity, decreases diabetes, it increases a robust immune system response. You get a good immune system. It decreases anxiety and depression, lowers fatigue, lowers cognitive impairment. It delays Alzheimer's disease in a lot of research. So it's extremely, extremely important in that regard. And regular physical exercise is what we recommend. At least 150 minutes a week of moderate intensity, usually aerobic, 50 to 70% of your maximum heart rate is what we like. Although even walking 3 miles a day at a good pace is extremely beneficial. You get a pedometer, you try to build up to 3 miles a day. Water aerobics are good if you're older. Swimming is very good. We like resistance exercise trainings 3 times a week in the absence of any contraindication, and that's been shown to also be very effective. Now, exercise improves endothelial function. It decreases your sugar, decreases basically all your risk factors for heart disease. Your blood pressure goes down, your lipids get better, your HDL cholesterol goes up. You get better insulin stimulation, blood flow, especially in athletes. We've seen that in studies. So that's one thing we do. So, in summary, you increase your insulin sensitivity with exercise. You increase your good HDL cholesterol, which is the vacuum cleaner. You increase weight loss. Something I didn't mention is that the mitochondrial biogenesis and gene expression improves with exercise, going down to the functional level. Even the mitochondrial size and number with adaptive training go up. So, the mitochondria are benefited by exercise. The expression of that endothelial nitric oxide synthase enzyme, which makes nitric oxide, goes up. The number of blood vessels, the volumes of them go up in the muscle. Your endothelial volume goes up. The endothelial cell volume goes up if you measure muscles when you exercise. And you get more nitric oxide. And also you can reduce oxidative stress and inflammation with exercise. And we can do blood tests to see how much oxidative stress someone has. There's chemicals you can do. They get improved and go down, your oxidative stress with exercise. It decreases stress, like emotional stress. Interestingly, exercise increases the volume in your brain of the gray matter, an area like the hippocampus, where you have your memory, or the caudate nucleus, or the prefrontal cortex. Exercise increases actually the brain, the amount of brain matter, the weight that you have, the volume. And also, exercise decreases orthopedic problems. Something that's interesting is exercise decreases your hypothalamus pituitary axis, so you have a reduced cortisol release and heart rate responses, which is good for your autonomics. And it also balances your autonomic system by giving you a better balance of parasympathetic to sympathetics. So not only your neuroendocrine system with the pituitary, hypothalamus pituitary and endocrine with the adrenal and cortisol levels get lowered and the heart rate gets better lowered, but also you get better balance with your autonomics, and we see better heart rate lowering effects with that. Cardiac rehab in people who have already had heart attacks has reduced future heart attacks and future evidence, so it's been very cardioprotective in that. And interestingly, it's neuroprotective. Exercise preserves your memory, preserves your spatial memory, your attention control, cognitive flexibility, and probably as a result of being anti-inflammatory and antioxidant effects. So I don't see anything about exercise, as long as it's done in moderation and there's no contraindication that's bad. Just make sure you get clearance from your doctor as to how much you can do.
My next question, Dr. Depace, is emotional stress, psychological stress. As a medical provider, as a physician, I have yet to find the perfect pill for emotional stress, psychological stress.
Boy, isn't that the truth?
Yet to find.
The
overprescribing of psychoactive drugs is just mind-boggling today. And my question is, the benefits of mind-body techniques, mind-body stress reductions, and why haven't we applied them more in our treatment as opposed to just whipping out our prescription pad and writing a medication? Because so many of those medications have side effects, and then you develop what they call as a tachyphylaxis or a tolerance. And I'm not just talking about the Xanaxes and the Lcarnitine. Also other medications, antipsychotic medications, antidepressant medications. I'm not saying I don't prescribe them. I'm just saying is we don't prescribe enough of the non-pharmacologic approaches.
Isn't that the truth? I mean, remember when we started our discussions way back, we talked about Sir William Osler saying when you take medicines, you got to recover from two things, the disease and the medicines. And there are a lot of toxic effects with these medications. And sometimes we add too many on and we increase the dose too much. And homeopathy says a little bit of medicine is good, maybe more is not better. See, stress is a word that is used to describe something that's challenging emotionally or physiologically to an individual. It's a state of like a threatened homeostasis, which is countered by some kind of adaptive process we do, and we look to suppress stress with the best adaptation methods we have, and sometimes they fail, and we try to figure out how we're going to get stress reduced. There was a philosopher, Rene Descartes, in the 15th, 16th century believed in dualism, that is a separation between the mind and the body. However, today the health psychologists think just the opposite, that there is a mind-body connection. And why is that so? Well, we know that stress causes free radicals, increased oxygen superoxide free radicals. And we know that it impairs vagal tone, which increases cardiovascular disease, so it hurts the autonomic function. We know it activates the hypothalamic pituitary axis. You get all this cortisol floating around, which is not good. We know it activates the sympathetic adrenal medullary system. So these are things that get revved up. They're maladaptive, actually, for stress. And how do we reduce them? Well, we can reduce them by certain techniques. And medicine's not always the best thing. I mean, if you take Xanax or benzodiazepams, it wears off after a couple of hours. The stress doesn't go away. It's like a Band-Aid again. It's like something that's just palliative. So the things that we like to lower stress are meditation. Has been extremely effective, whether it's transcendental, mindful, yoga, different types of, and you have to really look at and maybe even take a course or go to an expert on how to do the proper meditation. Meditation has been shown to nicely reduce stress over a long period of time, and we recommend that to our patients. Progressive relaxation techniques, which I wrote about in my first book in 1992. We teach people breathing exercise and relaxation techniques. Exercise, of course, is a great stress reducer. Acupuncture, which you know about, has been shown to reduce stress. Massage, deep breathing exercises, hypnosis, biofeedback, where you watch measurements of your heart rate and blood pressure and try to control them. All these techniques work. Cognitive behavior therapy works, and I believe they work better than medicines to reduce stress. Yeah, psychological stress really impairs vagal tone. It inhibits the hypothalamic pituitary adrenal axis, with the cortisol being overproduced. It activates the sympathetic adrenal system, and these are maladaptive sort of responses.
Yeah. Dr. Depace, can stress actually promote or cause disease?
The answer to that is yes. There was a study by Cohen where you had 276 healthy adults and exposed them to the common cold virus and quarantined them for 5 days. And patients with stress exposure developed common colds at higher frequency than people who didn't have stress exposures. So that was showing that there is some immune abnormalities there. Then there was a big study by Yusuf in the Interheart study. Was 52 patients, or rather 52 countries or 56 countries, that showed that psychosocial stress is a big risk factor for heart attack, as high as smoking or diabetes or any other risk factors. Emotional stress has been shown to trigger pulmonary embolism. People who take long rides, for example, immobilized in a car and have a lot of psychological stress have higher incidences of pulmonary embolism, so it sort of makes the blood even thicker. It's believed it enhances thrombosis in those people. Some viral cancers are believed to be increased with chronic emotional stress, or even acute stress can cause problems. Problems with HIV patients because their immune function is down. Stress worsens diabetes, may cause autoimmune diseases, may cause depression, headache disorders, anxiety disorders. And I've been reading articles, you can comment in a few minutes, on substance abuse being caused by stress. Certainly post-traumatic stress disorder is caused by stress. That's That's a given as one disease that's caused by stress. Insomnia is caused by stress. A lot of GI diseases like irritable bowel syndrome, we believe, are significantly contributed. Stress contributes to them, and reflux. Some people believe inflammatory bowel disease and peptic ulcer diseases are stress-induced in many instances. There's a heart disease called Takotsubo's or stress cardiomyopathy, and acute stress can actually cause the heart to get paralyzed and start beating very poorly and weakly, and you can go into heart failure, you can get sudden cardiac death from that, and that's been shown to be caused by acute emotional stress. So, your immune system can be altered, you can get inflammation, and as I said, atherosclerotic cardiovascular disease. Remember, stress does a lot of bad things. It causes high levels of epinephrine, norepinephrine, raises the heart rate and blood pressure. It doesn't let the platelets get inhibited. They clump together and can cause clots. It shifts blood away from organs to skeletal muscle. It releases sugar by the liver, and blood clotting goes up. So there's nothing good about stress, especially when it increases the alarm type reactions with the sympathetics and the adrenal system. So yes, we believe stress can cause a significant amount of disease entities, or at least contribute to their cause, yes.